Good day everyone, hi, it's me again, Nurse May, and in continuation of our medication return demonstration, today I'll be showing you how to administer a oral medication. In administering medication, we must always remember the 10 rights. First is the right medication, right dose, right time, route, client education, documentation, right to refuse, right assessment, and right evaluation. So the first thing that we are going to do is to perform a hand hygiene. It's either to wash our hands or to sanitize them and observe the appropriate infection control procedures. Next, we are going to read the medication order and take the appropriate medication in the shelf or in the drawer. So as if this is our drawer, I'm gonna get the medication here. Now we are going to compare the medication and the medication order of the patient. So here, then we are going to check for the expiration date of the medication and prepare the correct amount of the medication that is being required to the patient. Okay. So as if we are preparing a medication from a package unit dose of capsules or tablet, like this for example, as if like this. So what we are going to do is we are going to get a cup. Then directly, we are going to pour the exact amount of medication to the cup. So as if the medication order says 2 capsules of the medication that is being written, so we are going to pour 2 capsules in the cup. However, if we are using or we are going to get a medication from a stock container or a medication coming from like this, it has a container, it's not packed. So the first thing that we are going to do is we are going to pour the required number into the bottle cup and then transfer the medication to the disposable cup without touching the tablets. So we're going to open it and we are going to pour. We are going now to pour the exact amount. So if the medication record says 2 tablets, so we are going to get 2 tablets and immediately we are going to pour it into the disposable cups. So here, and making sure that we are not touching the tablets or the medication. So for example, our client or our patient is having a trouble in swallowing the tablet. So we have here a tablet crusher wherein we are going to crush the tablet into fine powder. So it's easier for the patient to swallow it. We are going to crush it into a fine powder. Something like this. So for liquid medication, as if this is a liquid medication, since I cannot get any liquid medication outside, because our community is under MGCQ again due to the increasing number of COVID-19 cases in our community here in Cantilan. So as if this is a liquid medication, so the first thing that we are going to do is to roughly mix the medication. Okay, so as if this is a medication, we are going to mix it properly. Then next we are going to remove the cup and place it upside down on a countertop. So we are going to remove and place it upside. And we are going to place it in a countertop. Okay, there. Then we are going to hold the bottle. We are going to hold the bottle. So the label, for example, this is the label. This is the part we are going to hold on. So when we pour it into a medication cup, the medication will not easily wet the label of the medication. So for example, this is the medication label. So this is the part where we are going to hold on. So this is the part where we are going to pour this part. So here we're going to pour it. Pour in the exact amount of medication that is being said to the medication record of the patient. So as if it says 15 milligram in the medication record, there. Then after, before we put back the medication cup, first we are going to wipe the lip of the medication bottle. So we are going to wipe it up before putting back the medication cup. Next, we are going to introduce ourselves and verify the client's identity. After, we are now going to provide privacy for the client. It's either to close the door or to close the curtains. Next, we are going to assist the client into a sitting up position if possible, or into a side lying position. So after we provide privacy to the patient, and after we position the patient, and after we check the identification of the patient, the next thing that we are going to do is to explain the purpose of the medication, the significance of the medication, and how it will help the patient. Now, in administering the medication to the patient, we must always remember to give a sufficient water, of course, give sufficient water to the patient, so it's easier for him or her to swallow the medication, especially when it is a tablet or capsule. So in administering a oral medication, there are 3 different ways where we can instruct our patient or our client on where they can place the tablet on their mouth. So first is the sublingual, or under the patient's tongue. Then second, we have the buccal, or against the cheeks of the patient. Then third, the NGT or the nasogastric tube, where we are going to crush the tablet or open the capsules and dissolve it into a powder with 20 to 30 ml of warm water in a cup. Lastly, we are going to record the medication that is being given to the patient, its dosage, the time that we give the medication, any complaints or assessment of the client, and our signature. And then we are going to dispose all the soiled supplies, and we are going to wash or sanitize our hands.